He reaches for his phone the way he always does, the same lean, the same twist at the waist, the same angle he has held his neck at for the better part of a decade. He is reading the morning headlines. He is catching up on messages from his daughter. He is comfortable. But somewhere between his second vertebra and the base of his skull, something is not comfortable at all. It has not been for a while. He just has not found the right word for it yet. Here is what most routine medical visits simply do not have room to address. The daily habits that act as silent accelerators of nerve damage. Not dramatically, not suddenly, but gradually. The way a slow leak ruins a foundation before anyone notices the crack. The nervous system is not checked the way blood pressure is checked. There is no quick test for the kind of quiet, cumulative compression that builds over years of the same repeated posture, the same repeated angle, the same repeated demand placed on tissue that, after 60, no longer has the recovery capacity it once did. This hidden catalyst is in your hands right now, possibly even as you watch this. And the window to change its effect is still open, but it does not stay open indefinitely. My name is Dr. Evan Noris. I am a neurologist with 20 years of clinical experience, focused on nerve health and sensory function in adults over 60. What motivated this particular video is the consistent gap I see between what patients are experiencing and what anyone has taken the time to explain to them about why. After 60, the nervous system operates under a set of biological conditions that make it significantly more vulnerable to the kind of damage we are going to discuss today. The protective myelin sheath, think of it as the rubber insulation coating an electrical wire, naturally thins with age. When that insulation is thin, signals traveling along the nerve are less precise, more easily disrupted, and slower to recover after compression or stress. The spinal cord itself has less cushioning fluid surrounding it than it did at 40. The intervertebral discs, which act as shock absorbers between the vertebrae, lose height and hydration over decades, like sponges that have slowly dried out and can no longer fully buffer the bones above and below. When you add prolonged postural stress to a nervous system already operating on thinner margins, the result is not pain alone. It is tingling. It is numbness. It is weakness in the hands that makes opening jars feel suddenly unreliable. It is a balance shift so subtle you do not notice it until the day you reach for the handrail on the stairs and realize you genuinely needed it. These are not inconveniences. They are early signals of a process that, left unaddressed, threatens the independence most of us consider non-negotiable. Before we go further, I want to ask you something. Have you noticed any tingling, numbness, or unusual weakness in your hands or feet in the past 6 months? Just type yes or no in the comments. Your answer genuinely shapes how I approach the rest of this conversation. But here's the question that keeps coming up in my practice, and that I want to answer for you today. Why does this habit devastate some seniors, while others seem to escape its worst effects entirely? The answer lies in something I call the nerve tolerance threshold, a hidden ceiling that varies from person to person based on their disc health, their baseline nerve conduction, and their accumulated postural history. Once you understand where your threshold is, everything I am about to share will make far more sense. The first habit I want to address is the one hiding in plain sight. Extended forward head posture while using a smartphone, tablet, or laptop. For every inch your head moves forward of your shoulders, the effective weight it places on the cervical spine roughly doubles. At a neutral position, the head weighs approximately 10 to 12 pounds. At a 45-degree forward tilt, which is the angle most people adopt while looking at a phone in their lap, research published by Dr. Kenneth Hansraj in the journal Surgical Technology International calculated that the effective load on the cervical spine approaches 60 pounds. Think of that as the difference between carrying a handbag on your shoulder versus carrying a loaded suitcase on the back of your neck. After 60, with discs that have lost height and hydration, with a spinal cord that has less cushioning fluid around it, that mechanical load compresses the very nerve roots responsible for sensation and strength in the arms, hands, and fingers. Over months and years, this compression is not neutral. It is a silent accelerator of the tingling, the weakness, the numbness that so many seniors accept as simply getting older. A patient named Greta, a former architectural drafter, who had spent her career bent over drawing boards and had transitioned enthusiastically into the digital world after retirement, came to see me after her handwriting had deteriorated to the point where she could no longer sign her name the way she used to. No injury, no obvious cause. When I assessed her posture during phone use, her head was consistently 8 to 10 inches forward of neutral. Addressing that single postural habit, raising the device to eye level, using a stand, taking breaks, produced a measurable improvement in her hand control over the following 3 months. The practical fix: hold your phone or tablet at eye level rather than looking down at it. Set a reminder to check your head position every 20 minutes. Your cervical spine is carrying a load your nerves cannot afford. The second habit is one that feels like rest, and in some ways genuinely is, and that is sitting for prolonged periods in soft, unsupportive seating without any change in position. A deep sofa, a reclining chair, an unsupported posture that rounds the lower back and tilts the pelvis backward. These positions look relaxing, but place sustained stretch and compression on the lumbar nerve roots that run down through the hips and into the legs. In younger adults, the sciatic nerve and its branches can tolerate this sustained tension reasonably well, because the surrounding disc tissue is still hydrated enough to cushion the vertebrae and relieve nerve pressure when position changes. After 60, discs that have lost height mean the vertebrae sit closer together, and the nerve roots emerging from between them have less space. Prolonged slouched sitting narrows that space further. The result, over hours, is the kind of hip ache, leg heaviness, or foot numbness that many people attribute entirely to arthritis or poor circulation, when nerve compression is often a central contributor. A man named Solomon, a former radio broadcaster, whose voice had been his livelihood, and who now spent long hours in his favorite armchair, listening to programs he had admired for decades, came to see me with progressive numbness in both feet that had been building for over a year. His cardiovascular system was healthy, his circulation was adequate, but his chair, which he sat in for 5 to 7 hours daily in a position that rounded his lower back severely, was the hidden catalyst. A lumbar support cushion, repositioning instructions, and a standing break every 45 minutes produced a meaningful reduction in his foot numbness over 2 months. The practical fix: no sitting position, however comfortable, should be held for more than 45 minutes without a brief stand and movement break. A small lumbar support cushion, placed behind the lower back, can change the entire nerve load profile of prolonged sitting. The third habit is one that requires a little more explanation, because it involves something most seniors are actively doing for their health, and that is walking or exercising with chronically tight hip flexor muscles that have never been adequately addressed. The hip flexors are a group of muscles at the front of the hip that connect the spine to the upper leg. When these muscles are chronically shortened, which happens naturally after years of extended sitting, they pull the pelvis into an anterior tilt and create an exaggerated curve in the lower lumbar spine. That exaggerated curve compresses the posterior elements of the lumbar vertebrae and narrows the channels through which nerve roots exit the spine. When someone with chronically tight hip flexors then walks, especially at a brisk pace or uphill, that compression is dynamic and repeated with every stride. The result is what many seniors describe as leg pain or heaviness that appears after a certain distance of walking and is relieved by sitting, a pattern called neurogenic claudication, which is nerve-related rather than simply circulatory. A woman named Ingrid, a former competitive cyclist in her late 60s who remained deeply committed to daily exercise and could not understand why her legs began to fail her at a consistent point in every walk, came to see me, convinced her circulation was the problem. Her vascular health was actually excellent. What we found was severe hip flexor tightness that had never been addressed, combined with a lumbar posture during walking that was compressing nerve roots with every step. A targeted hip flexor stretching routine, performed daily for 6 weeks, produced a significant extension in how far she could walk before symptoms arrived. The practical fix: before any walk, spend 2 to 3 minutes doing a simple kneeling hip flexor stretch on each side. If you have been sitting for most of the day before you walk, your hip flexors need that release before your spine goes under load. If you are still with me and finding this valuable, type the word nerves in the comments right now. It genuinely helps me understand who this is reaching, and it helps the platform connect this information to others who need it. The fourth habit involves something almost invisible because it happens during sleep, and that is the sustained neck or spinal position held for hours on a pillow that provides the wrong height or firmness for your specific anatomy. During sleep, the nervous system is doing critical repair and maintenance work. Cerebrospinal fluid circulation increases. Inflammatory byproducts are cleared from around nerve tissue. But when the neck is held in a bent, twisted, or unsupported position for 6 to 8 hours, because the pillow is too soft and the head sinks, or too high and the neck angles upward, or because sleep position regularly places a shoulder or hip under prolonged compression, nerve roots that are already operating on thinner margins after 60 receive sustained stress precisely during the window when they most need relief. The tingling hands that many seniors wake with, the stiff neck that takes an hour to ease in the morning, the hip numbness that greets them before they even stand. These are often not random. They are the nervous system reporting the accumulated effect of hours in a position that compressed rather than protected it. A man named Aurelio, a former ceramics artist whose hands had been the instruments of 40 years of precise creative work, came to see me worried that his right hand had begun tingling and losing sensation reliably every morning. He was sleeping on his right side, with his arm folded under a pillow that sat too high, holding his neck in a lateral bend through the night. One targeted adjustment, a cervical support pillow of appropriate height, and a change in arm position, eliminated the morning tingling within 3 weeks. The practical fix: your pillow should keep your neck aligned with your spine in neutral, neither angled up nor drooping down. If you regularly wake with numbness, tingling, or stiffness that takes more than 20 minutes to resolve, discuss pillow height and sleep position with your doctor or a physical therapist. The fifth and final habit is one that accumulates so gradually it becomes invisible, and that is the daily absence of deliberate nerve-activating movement. By this, I do not mean intense exercise. I mean the specific, small movements that maintain circulation to peripheral nerves, keep nerve pathways firing regularly, and prevent the slow withdrawal of sensory precision that many seniors mistake for inevitable aging. Peripheral nerves, the ones running from your spine all the way out to your fingertips and toes, depend on steady blood flow and regular activation to remain healthy. When daily movement is reduced to walking from room to room, sitting for meals, and passive recreation, the peripheral nervous system loses the stimulation it needs to maintain its signal strength. Research from the peripheral neuropathy literature, including studies reviewed in the journal Neurology, has documented that low levels of physical activity in older adults are significantly associated with faster rates of peripheral sensory decline. Think of peripheral nerves like the far branches of a tree. When the water stops reaching the outer branches regularly, they are the first to thin and fail. A woman named Mirabelle, a former gemologist, who had spent her career making extremely fine sensory distinctions with her fingertips, came to see me distressed that the tactile sensitivity she had relied on professionally for decades was fading. She was not ill. She was not inactive in any dramatic sense. But her days had contracted. Less time outdoors, less variety of movement, fewer tasks that required fine motor engagement. We built a daily 15-minute routine of deliberate sensory movement. Barefoot walking on different textures, finger exercises, balance work, light resistance movement. Over 3 months, her reported tactile sensitivity measurably improved. The practical fix: build deliberate movement into every hour of your day, not just one scheduled exercise session. Walk barefoot on carpet for 5 minutes. Do gentle finger and wrist circles. Stand on one foot briefly while holding a stable surface. These are small acts that send large signals to a nervous system that needs to hear from you regularly. Here is what I want you to walk away with, and I want to say it plainly and personally. The nerve damage I have described today does not happen overnight, and it does not have to be permanent. Starting today, raise your phone to eye level and protect your cervical spine from that invisible load. Get up from your chair every 45 minutes, even for 60 seconds. Stretch your hip flexors before you walk. Check your pillow height and consider whether you regularly wake with symptoms that should not be there. And build some form of deliberate sensory movement into every day, not as exercise, but as maintenance of the system that makes independent life possible. You do not need to overhaul your life. You need to adjust a handful of daily habits that are currently working against a nervous system that deserves your attention and protection. Everything I have shared today is meant to be a starting point for a conversation with your own physician or neurologist, not a substitute for one. Your specific nerve health, your imaging history, and any existing diagnoses all shape what the right approach is for you. Please bring these ideas to your doctor as a partner. They will be glad you did. And if today's conversation has raised questions about what else is quietly affecting your nervous system, the next thing I want to share with you is how chronic, low-level inflammation, the kind that produces no obvious symptoms, may be one of the most significant and most addressable drivers of nerve decline in adults over 60.